Hello everyone, my name is Tolulope Famuyuru. I'm a third year resident at the University of Texas Health Science Center at Houston. My co-authors on this project are Dr. Ruiz, who is one of my colleagues, Dr. Tyler and Dr. Iyengar, my project mentors, and the study coordinator is Ms. Klawan. The title of my project is Resident Burnout, Contributing Factors and Effect on Patient Care Practices. And a brief introduction, physician burnout remains an important and widely discussed topic within the U.S. healthcare system and amongst academic organizations such as the American Academy of Family Physicians, the Society of Teachers of Family Medicine, the American Medical Association, and the Accreditation Council for Graduate Medical Education. Over the years, several literatures have tried to identify the cause of burnout with the intention to use the results to develop interventions that could help mitigate this problem. Burnout is therefore defined as a state of physical, mental breakdown that is linked to prolonged unresolved work-related stress. It was first described by Dr. Schanafeld after using the Maslach Burnout Inventory Scale to conduct a study which showed that 50% of physicians have at least one symptom of burnout, and also that burnout was linked directly with the practice of suboptimal patient care. The Maslach Burnout Inventory is a 22-item questionnaire that looks at three cardinal issues with regards to burnout. It includes the emotional exhaustion, depersonalization, and reduced feeling of personal accomplishment. According to the AAFP, residents in frontline specialties like family medicine are likely to report burnout. The drivers of burnout are unlimited, to name a few: the complex electronic medical record, inadequate manpower, organization policy constantly changing, those with personality type A, long work hours, sleep and nutritional deprivation are some of the drivers. And further, the consequences of untamed burnout includes poor health for the trainee, the likelihood of the trainee leaving the program prematurely, the risk of making medication or treatment error, high risk of suicide, depression, high divorce rate, and death. Equipped with this knowledge, our program was interested in assessing the burnout prevalence amongst the trainees, also to identify if there were some demographic traits or contributing factors to burnout, and lastly to determine if there is an association between those who are endorsing burnout and the practice of suboptimal patient care. Therefore, in January of 2020, a paper-based survey was designed and administered to all residents in our program. The survey had three sections. The section A assessed the demographics of the trainee. It asked questions about the age of the trainee, the gender of the trainee, the marital status, the current rotation, whether they were an inpatient or outpatient, the year the resident was in training, and whether the trainee had children or not. The second section of our survey measured burnout using questions from the Maslach Burnout Inventory, particularly questions regarding emotional exhaustion. I feel burnt out from work and I feel I'm working too hard on my job. And from the depersonalization section, we asked if they are becoming less kind toward patients since they took the job, or if they worry that their job is hardening them emotionally. From the section C, which is the third section of our survey, we assessed suboptimal patient care practice using four standardized questions that was drafted from another survey, and it asks questions about in the past week if the trainee has felt guilty about how they treated a patient from a humanitarian standpoint, whether they paid little attention to the social or personal impact of a patient's illness, or made treatment error that was not due to lack of knowledge or experience, and lastly, if they discharged patients to make the service more manageable. The responses was ranked using the Likert scale, and it ranged from the response of never to always. Participants endorsed burnout or practice of suboptimal patient care if they answered sometimes to always to any of the questions as listed. Cross-tabulation was used to analyze the relationship between burnout and suboptimal patient care practice, and the responses were characterized using the frequency and percentages. Out of 36 residents in our program, 34 residents completed the survey, giving us a 94% response rate. Of the 34 who filled the survey, 7 identified that they were experiencing burnout, which was like 1/3 of our respondents. And with comparison to the male, more female had endorsed burnout. Those who were married were also identified to experience more burnout. With regards to the year in training, postgraduate year 1 and 2 were more likely to endorse burnout. We had 3 residents in the postgraduate year 1 and 3 in the postgraduate year 2, compared to postgraduate year 3, which was only 1 resident. And on the questions to differentiate whether burnout was prevalent amidst international medical graduate versus US medical graduate, there was a very slight difference between the response. Residents from the non-US medical school appeared marginally more likely to experience burnout. And with regards to the question on the suboptimal patient care, we identified that irrespective of whether they were reporting or not reporting burnout, both parties admitted to the practice of suboptimal patient care. And the 2 common listed practice was, I found myself discharging patients to make service more manageable, and I paid little attention to the social or personal impact of illness on a patient. Keep in mind that because our sample size was very small, we were unable to calculate power or to assess for statistical significance or association with our result. And our conclusions are as follows. Burnout may be occurring at a significantly higher level among family medicine residents. The gender, marital status, and the clinical setting, particularly being an inpatient, could play a role in potentiating burnout. Lastly, burnout may not be the only factor contributing to the practice of suboptimal patient care amongst training. Based off on the results that we had, we were able to make some recommendation. The first is that annual burnout surveillance or a biannual surveillance should be conducted amongst residents to be able to identify burnout prevalence or incidents timely. The second thing was also we recommended for the schedule of residents to be reviewed to avoid inpatient overlap, especially since the residents had mentioned that inpatient could predispose them to having a higher rates of burnout. We also suggested that the unique traits of the trainees should be factored into the schedule allocation. Residents who are married, who have children, or are likely to have maternity leave could be given the preferences to select their schedule ahead of time to accommodate their needs. We also suggest that wellness activity such as meditation, engaging in talent shows, or book reading club could also be incorporated as part of the didactic curriculum. Given that our result had showed that postgraduate year 1 and 2 were likely to experience more burnout, and also burnout was high in inpatient service, we decided to look into our schedule of the postgraduate year 1 and 2. And what we noticed on the postgraduate year 1 on our schedule was that there was multiple inpatient rotation overlap, and which could explain this report of burnout. Based off of that, we therefore proposed a model which is called the time to shuffle, and we reshuffled the schedule. And the picture that you see is the model of the schedule that was before we did the study, and the model after we had reshuffled the schedule. We believe that with this schedule modification and incorporating some wellness activity, this will definitely promote some improved wellness amongst our residents. I'd like to acknowledge all the residents for completing the survey. I'd like to thank the mentors and the study coordinator of this project. The authors of this project have no conflict of interest, and references are available upon request.